your jugular venous pressure and your carotid pulsations. I'm first going to have you turn to your left, and I'm going to note interiorly for your jugular pulsations. I'm also going to measure the point of pressure for your jugular vein. Can you look forward, Phoebe, please? I am measuring at the highest point of pulsation, and you're at about 1.5 centimeters, and typically anything under 3 is within normal limits. I'm going to now inspect and palpate the carotid on both sides. Perfect. And I'm now going to auscultate the carotid, noting for any bruits. I'm going to do it with my diaphragm and the bell of my stethoscope. Starting with the diaphragm first. And noting that it sounds like a brisk upward pulsation and sound. Great. Do it with the bell. And for time purposes, I'll be going through the motions for most of this assessment. I'm now going to inspect the chest, noting for symmetry, noting for any masses, any lesions, or any abnormalities. And then I am going to palpate, starting at the second intercostal space of the aortic on the right side. Moving on to the left side, the pulmonic area, going down to the third intercostal space, fourth intercostal space, and the fifth intercostal space, feeling for that point of maximum pulsation. Great. And I wanted to note that the Erb's point, I will be auscultating and part of my palpation, part of the examination. I'm going to do it with both the diaphragm and the bell. I'm going to auscultate over that second intercostal space on the right side, the aortic, moving on to the pulmonic at that second intercostal space on the left side, Erb's point, third, fourth, fifth intercostal space, noting that maximum point of impulse. Great. I'm now going to do it with the bell for timing purposes. I'm going to go through that second pulmonic, third, fourth, and fifth intercostal spacing, that mitral area right there. Phoebe, do you mind turning to your left-hand side, please? I'm going to auscultate. You can lay on your left side, I'm sorry. I'm going right under that fifth intercostal space and assessing that mitral for mitral stenosis. Great, sounds good. And Phoebe, what I'm going to have you do is now sit up, and I'm going to have you take a deep breath in, and when you exhale, you hold that. I'm going to auscultate right on that second intercostal space, that left sternal border. And I am noting, I'm going to have you lean forward when you do that, and I'm going to assess for aortic regurgitation. Now take a deep breath in and out and hold it. Perfect, great. I'm going to have you lay back again, and I am going to move on to the peripheral vascular system. I'm going to have you hold your hands straight out. I'm assessing temperature, symmetry. I'm assessing your skin at the same time. I'm going to look at your nail beds, noting for any cyanosis. I am going to move on to your radial pulse on your right side, and then I'm going to do both your radial pulses on the right and the left at the same time, noting symmetry. I am going to your brachial pulse, and then the same thing. I'm going to assess both sides, noting symmetry. I'm going to have you make it like you were making a muscle, And right here between your muscles here, I'm going to feel it for your epitrochial nodules. And those are pretty hard to palpate normally. And then Phoebe, I'm going to have you put your hands behind your head, and I'm going to palpate your axillary areas, your axillary nodules. Great. And I'm going to go down to your inguinal, palpating there. Great. And now we're going to do what's called an Allen's test, Phoebe. And what I want you to do is make a strong fist. And I'm going to palpate both your radial and your ulnar pulses. Can you let go? And great. I let go of the ulnar. Can you make a tight fist again? And now I'm letting go of and let go. And I'm let going of the radial and noting skin and color. Next, I'm going to assess your lower extremities. I'm noting color, hair distribution, your skin for any lesions, any abnormalities, characteristics. I'm noting temperature. I'm palpating for any edema. Great. I am noting your popliteal pulse. I'm going down to your dorsal pedis. And then your posterior tibial. Great. And up to your femoral. And for time purposes, I would be doing that on both sides of Phoebe's extremities. And now, Phoebe, I'm moving on to your abdominal area. And I'm first inspecting. I'm noting for characteristics, any lesions, any masses, contour, striae. And next, I'm moving on to auscultation. I'm going to auscultate all 4 quadrants, knowing that typically it would be a minute, but for purposes of this video, I'm doing location. I'm moving on to the aorta, renal, femoral, and the arteries. Okay, so now I'm going to assess and auscultate the right lower quadrant, up right quadrant, lower left, upper left, aorta, renal, and then down to the femoral, spacing that area. Great. I'm going over to the right side and auscultating that spleen area. And then the liver. Great. And I'm now going to percuss all 4 quadrants, noting tympany, any dullness. And I am going to go to the anterior, lower anterior, and percuss up to the liver border. And noting, measuring the span of the liver, and I'm going to go in between the ribs.
I'll just have you walk to this table in the back. Okay, thank you. So patient's stable. She has an equal arm swing and her posture is straight. And then if you will put one leg up and hop on the other one. Okay. And then on the other leg. Okay. And then if you can stick one leg out and bend your knee. Okay, thank you. So you can sit back down. So the patient was able to complete the movements. Next, we're going to test your patella. Okay, so patient's patellar reflexes were at had two, and they were symmetrical. And then lift this up. Is it okay if I take your socks off?
Yes. Sorry.
You're fine. Okay. Patient's Babinski reflex was negative.
Didn't mean to scare
Oh wait,
you.
actually. Okay. Right. And if you want to lay all the way back. So we're just going to be testing your stimuli. So this is sharp and that's dull.
Okay.
So if you'll just close your eyes and tell me what you feel.
Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull.
Alright, so patient was able to correctly state sharp and dull in both upper and lower extremities. So you just want to sit up for me. And it was symmetrical bilaterally as well. Okay, do you have any recent change in smell?
No.
Okay, so cranial nerve. Cranial nerve number 1 is intact because of no change of smell. And then for cranial nerve 2, I would have you read the Snellen chart. You'd stand 20 feet away, cover one eye, the other eye, and then uncover both, and read to your lowest line with glasses or contacts if you wear them. And 20/20 is expected. If it's 20/30 or higher, I would refer you to a specialist. And then if you will just read this first line for me.
Caution, failure to follow instructions.
Okay, thank you. So patient's near vision was intact because she was able to read 14-inch font 14 inches away. So cranial nerve 2 is intact. Next we're going to do 3, 4, and 6. So I'm just going to check. Okay, so they are 4 millimeters and they are equal and round. And next I'm just going to shine a light into each eye twice. Correct. Consensual. Consensual. Okay, and then if you'll just follow this in. Okay. So her eyes were able to accommodate, and her pupils constricted when the light. Now, if you can just follow my pen light with just your eyes. So cranial nerve 3, 4, and 6 are intact. Patient's eyes were perla, and then move to cranial nerve 5. So I'm just gonna put my hands on your cheeks, and if you'll just clench your jaw for me. Okay, and then I'm just gonna have you close your eyes, and you can just tell me when you feel this.
No. 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 No.
Okay. So cranial nerve 5 is intact. This patient was able to clench jaw symmetrically, and was there any pain with that?
Mm-hmm.
Okay, no pain, and she was also able to feel the stimuli bilaterally. And then cranial nerve 7. If you can raise your eyebrows, close your eyes tightly, smile, frown, and puff out your cheeks. Okay, cranial nerve 7 is intact because the patient was able to make faces, and they were symmetrical, and there was no dripping or anything. So if you just want to turn face this way for me, and then if you'll cover one ear, and I'm going to whisper a word and you can repeat it back.
Pineapple.
Okay, good. And then
Raspberry.
Yes. Okay. Good job. So cranial nerve 8 is intact because patient was able to repeat back the words I stated. We're gonna go to 9 and 10. If you'll just say, open your mouth and say ah. Okay, thank you. So, patient's uvula went up and in towards midline. Her tonsillar pillars and soft palate did as well. So 9 and 10 is intact. Cranial nerve 11. So I'm going to put my hand on your face. You'll just push against it. Okay, and the other side. Okay, so patient's sternal mastoid muscle was strong and it was symmetrical. And then I'm just going to hands on your shoulders and if you'll raise up. Okay. And was there any pain in either of those? Okay, so no tenderness, and then the trapezius muscle was strong and symmetrical as well. So cranial nerve 11 is intact. And then for cranial nerve 12, can you stick your tongue out and then to either side? Okay. And then can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. And patient was able to state the words without stuttering or having trouble, and her tongue was midline when she stuck it out. So it's intact. Can I get you anything else?
Movement cranial nerve 3, and we're going to assess for eye movement. If you could just follow my pen light. And this is the 6th cardinal vision exam. Perfect. And that was also testing cranial nerves 3, 4, and 6. Next, we're going to do the trigeminal cranial nerve. If you can close your eyes for me and just let me know if you can feel this.
Yes. Yes. Yes.
Okay. Next, we did the abducens cranial nerve, which was eye movement, and now we're doing the facial cranial nerve. So I'm checking for symmetry, and that's skull and facial, and everything is symmetrical. Next, I'm testing cranial nerve 8, which is the glossopharyngeal. Vestibulocochlear cranial nerve, and that's to test your hearing. So this is the Weaver test. Please let me know if you hear that symmetrically.
Yes.
Okay, and now we're gonna do the Rhine test. And just let me know when you can no longer hear that vibration.
No. No.
Okay, and we're doing the same on the left side, the right side.
No.
Okay, perfect. So moving on, we're going to test for the glossopharyngeal cranial nerve, which is related to your gag reflex. If you can open your mouth. And that triggered that. And then we're going to do taste.
Orange?
Yep, perfect. So next we're going to test for the vagus nerve, which was the gag reflex. And then we're doing the cranial nerve 11, which is spinal accessory. So I'm going to put my hands on your shoulders, and if you could just lift for me. Okay, your head movement, if you could just move to the right and to the left. Last nerve is the hypoglossal nerve, and that's tongue movement. So if you can take your tongue out for me, move to the right, to the left, up, down, and then if you could just swallow. Okay, so all cranial nerves were tested. Now we're doing cerebellum function, which is related to memory. So can you tell me what you had for lunch today?
Pizza.
Okay, fund of knowledge is next. What was the last holiday?
Valentine's Day.
And then attention span. So just repeat these 3 numbers. 1, 5, and 6.
1, 5, 6.
Next is concentration. So you're going to memorize these 3 words, and then I'll ask you later. So the 3 words are car, orange, and yellow.
Okay. Alright.
So next, tell me about your next vacation trip.
My next vacation trip might be to Colombia, and I'm gonna go with some friends.
Okay, and what 3 words did I ask you to remember?
Car, orange, yellow.
Perfect. So that tested concentration, language, and next is abstract thinking. So what do oranges and apples have alike?
They are fruits.
Perfect. So that takes care of that. Walk in a straight line. And then on the way back, walk on your tippy toes. And now on your heels. Perfect. And then if you could hop. Okay. So your balance is steady and you don't have any issues with that. If you could close your eyes, we're going to do the Round-Briggs test now. And you're going to put your arms straight out. We're looking for a pronator drift. And I don't see, excuse me, any signs of that. So that's normal. Now, if you can have a, so we're going to test for coordination. So we're going to do the finger to nose test. You're going to close your eyes with your right hand. You're going to point on to your nose. And now you're going to do the same with your left. Perfect. We're also going to do rapid alternating movement test. So with your arms on your lap, you're going to put your palms up and down rapidly. Awesome. And lastly, it's a heel to shin test. You're going to take your right heel and run your heel on your left shin and then do the same with your left. Perfect. So there's no neurological abnormalities there.